It's about something we do every day, eating carbohydrates, rice, bread, pasta, fruits, snacks, even sugary drinks. Carbs are everywhere. Yet, carbs are also one of the most feared and misunderstood parts of our diet. Some people completely avoid them. Some blame them for weight gain or diabetes, and others are just confused. So, today, let's clear the noise. In simple words, backed by medical science, and most importantly, practical for real life. Before we start the podcast, an important medical disclaimer. This podcast is for educational purposes only and does not replace professional medical advice. Always consult your physician, registered dietitian, or qualified healthcare provider before making changes to your diet, managing blood sugar, or treating any medical condition. Hello, everyone. I'm Dr. Kuldeep Singh, and today's discussion is going to be an eye opener for many of you. What are the carbohydrates really? Carbohydrates are one of three main nutrients our body needs, along with the protein and fats. They are primary source of energy, especially for your brain and nervous system. When you eat carbs, your body converts them into glucose. Glucose powers your brain, muscles, heart, and everyday functions. So carbs are not optional, they are essential. The problem isn't carbohydrates themselves. The problem is which carbs we choose and how we eat them. Simple versus complex carbs. Let me break this down very clearly. There are two main types of carbohydrates. Simple carbs like sugar, soda, snacks, sweets, and fruit juices. They digest very fast and cause quick spikes in blood sugar. Then there are complex carbs. These include whole grains, fruits, vegetables, lentils, and beans. They digest slowly and provide steady energy. When blood sugar spikes happen again and again, the body starts to become resistant to insulin. This is one of the earliest steps towards type 2 diabetes. Let's talk about glycemic index, why it matters. You may have heard the term glycemic index or GI. Simply put, it tells us how fast a food raises your blood sugar. High glycemic index foods like white bread, white rice, and sugary drinks, they raise sugars quickly. And low glycemic index foods like whole grains, lentils, and vegetables raise it slowly. High GI foods regularly forces your pancreas to work harder, leading to insulin resistance, weight gain, high risk for diabetes and heart disease. That is why even normal foods can become harmful when refined or eaten in excess. Let's talk about insulin and insulin resistance. Insulin is a hormone naturally produced by beta cells of pancreas that helps move glucose from your body into your cells. So think of insulin as a key and your cell as a lock. When the key works well, sugar enters the cell and energy is produced. When the lock stops responding, sugar stays in the blood. This condition is called insulin resistance. The scary part is that it often has no symptoms at first. And that is why most people do not realize what's happening until blood sugar stays high for years and years and it shows up in their blood work like elevated hemoglobin A1C. That is why I routinely test my patients not only for hemoglobin A1C but also for insulin resistance. Even before diabetes develops, the insulin resistance markers can be high, and that is a condition called prediabetes. Why fiber is your best friend? So, fiber is a type of complex carbohydrate and it is extremely protective. Fiber slows digestion, prevents sugar spikes, improves gut health, keeps you full longer, and supports heart health. Foods rich in fiber like vegetables, fruits, whole grains, and legumes help your body handle carbs safely and effectively. High fiber diets are strongly linked to lower risk of diabetes and heart disease. Quality over quantity. Many people ask me, Doc, how many carbs should I eat? My answer is simple. Focus on quality first. Processed foods such as white flour, sugary snacks, packaged foods, they give calories without nutrition. High quality carbs like whole grains, fruits, vegetables, lentils, and beans, they nourish your body and stabilize blood sugar. Here is what I recommend to most people: choose fiber rich carbs, limit refined and sugary foods, pair carbs with protein or healthy fats, and watch portion size. Even with the healthy foods, you don't need to eliminate carbs, you just need to eat them intelligently. Remember, small consistent changes create big time long term results. Let's discuss long term benefits of healthy carbs. When you eat high quality carbs in balanced meals, you can reduce your diabetes risk, improve your insulin sensitivity, protect your heart, maintain healthy weight, feel more energetic and focused. Your daily plate truly shapes up your future health. So let me leave you with this: carbohydrates are not your enemy. Lack of understanding is. Choose wisely, eat mindfully, balance your meals. Your body is incredibly intelligent. When you support it, it takes care of you. If this episode helped you, please like, subscribe, and share it with someone who needs clarity around carbs and blood sugar. Drop your question in the comments. I'll be happy to address them in the future episodes. Until next time, eat smart, stay balanced, and take care of your health.